Have you ever experienced that frustrating feeling when your eyes suddenly start watering, itching, and feeling gritty for no clear reason, making it hard to see or focus? Well, if so, you are definitely not alone. The simple and direct answer is a resounding yes. Watery eyes are indeed one of the most frequent and noticeable symptoms of allergies. It is a very common way your body reacts when it encounters something it perceives as a threat, even if that threat is completely harmless. Let's dive into the fascinating why behind this response. When an allergen like pollen, dust mites, or pet dander enters your immune system springs into action. For people with allergies, the immune system mistakenly identifies these harmless substances as dangerous invaders. This triggers a release of chemicals, primarily histamine, from specialized cells in your eyes. Histamine acts like a tiny alarm bell, causing the small blood vessels in your conjunctiva, which is the clear membrane covering the white part of your and the inside of your eyelids, to dilate and become more permeable. This means they become leakier, allowing fluid to escape into the surrounding tissues, which leads to swelling and redness. At the same time, this histamine also stimulates your tear glands to produce an excess amount of tears. This increased tear production is your body's natural attempt to flush out the perceived irritants and wash away those bothersome allergens, resulting in those telltale watery eyes. So, while it feels uncomfortable, it is actually your body doing its best to protect itself. So, what can you do when your eyes start to water from allergies? The first step is often to try and identify your specific triggers. Are your symptoms worse during certain seasons or after being around pets or in dusty environments? Once you have an idea, try to minimize your exposure. This might mean keeping windows closed during high pollen counts or using allergen-proof covers on your bedding. For immediate relief, over-the-counter options like artificial tears can help wash away allergens and soothe irritation. Antihistamine eye drops, specifically designed for allergic conjunctivitis, can also be very effective at blocking the histamine response and reducing symptoms like watering and itching. Oral antihistamines can help too, but sometimes cause dry eyes, so eye drops are often preferred for direct eye symptoms. It is interesting to note that watery eyes are a hallmark of allergic conjunctivitis, which is inflammation of the conjunctiva due to an allergic reaction. Understanding this specific term helps differentiate it from other causes of watery eyes, such as dry eye syndrome, which ironically can also lead to excessive tearing as a reflex response or an eye infection. Unlike infections, which often involve discharge or pain, allergic watery eyes are typically accompanied by intense itching. Another helpful tip is to avoid rubbing your eyes, as this can actually worsen the irritation and histamine releases, making the watering even more pronounced. By understanding that watery eyes are a protective response to allergens, you are empowered to take proactive steps to manage your discomfort. Knowing the why behind your symptoms, combined with practical how-to strategies like trigger avoidance and appropriate over-the-counter remedies, can significantly improve your daily comfort and overall health. If your symptoms are persistent, severe, or interfere with your daily life, always remember to consult with an eye care professional for a proper diagnosis and personalized treatment plan.